got a combination to give you a bright start. There's no better way to start your day. Get ready, everybody get ready for breakfast. Yes, get ready for breakfast. Eat Sunlight Daily.
Welcome back. You're watching Network Africa. It's our second edition this year, 2016. We're here in Nigeria. The Iranian government has continued to employ diplomatic channels to secure the release of Shiite leader Ibrahim el-Zakzaky, who was reportedly arrested by the army last month following a raid on the sect's camp in Kano. Sheikh al-Zakzaky, after members of his Islamic movements clashed with the army in the northern Nigerian city of Zaria. Campaign groups such as Human Rights Watch have said that at least 300 members of the sect were killed and were quickly buried in mass graves during the incident. The army has denied the claim, and they're accusing the pro-Iranian sect of trying to assassinate the Chief of Army Staff, Lieutenant General Tukur Buratai, beg your pardon, which they deny. Iran is currently embroiled in a diplomatic rout with Saudi Arabia over the execution of a prominent Shiite cleric, Sheikh Nimr al-Nimr, currently. So we'll see how this turns out, though. But in the meantime, Sudan has joined the list of countries cutting diplomatic ties with Iran, following the government's joining forces with Iran following Saudi Arabia's execution of a prominent Islamic cleric, Nimr al-Nimr, alongside 3 other Islamists and Al-Qaeda militants on Saturday. The Iranian Foreign Ministry did say that in response to the barbaric attacks on the Saudi Arabian embassy in Tehran and its consulate in Mashhad, the government of Sudan announced the immediate severing of ties with the Islamic Republic of Iran. There have been protests across many countries in the Middle East following Nimr al-Nimr's execution in Saudi Arabia, many of them saying that he was a peace-loving cleric in the country. But Nimr al-Nimr has been executed, that causing a diplomatic row. We'll have more on this later. In the meantime, here in Nigeria, to health matters, the Taraba state government says it is trying to contain the outbreak of Lassa fever. State Commissioner for Health, Dr. Innocent Vakai, said 1 person has been confirmed dead. 2 others are still being observed. He has blood samples have been taken to the Irwa Specialist Hospital in Edo State for further confirmation. The Information Commissioner is also asking members of the public not to panic, as the state's government has responded swiftly to the attack. A Lassa fever outbreak occurred in Taraba State last in February 2012, causing the death of 10 people, including a doctor and 2 nurses who attended to the patients. Let's get more now on this story. Dr. Musa Obadiah joins me now from Taraba State as a public health official. Dr. Obadiah, thank you for joining us on Network Africa.
Thank you very much for inviting me to join the Channels Television, the award-winning television.
Thank you so much. So let's get right into it. Tell us the situation in Taraba. What are we really looking at? How bad has the fever spread?
Well, the situation now is that 2 people are currently under observation. And so far, I think we've lost more than 2 people. And some of the 5 cases are being under observation so far. And they come from various areas within the metropolis and the neighboring communities to Jalingo, the state headquarters.
Do we know how this started? I mean, do we know where it began? The town, or the situation surrounding how Lassa fever just sprung up in Taraba?
Well, certainly in the past couple of years we've been having recurrent cases of Lassa fever. The last case was about 2 or 3 years ago, but in the past 10 years we've been having issues. So it's not something very new, but at least the index case, which is the first case that presented at the Federal Medical Center, came from within the town around the Sabonlai area, which is one of the filthy places in Taraba State. But we also have cases recorded from other areas of the town. They are not from a particular defined area, but they're a little bit scattered. And we also have cases coming from neighboring local government known as Aldokola, and some of these areas that neighboring the Jalingo local governments, we have cases coming in. So it's not from a particular spot in Jalingo area.
Dr. Obadiah, if Taraba has had a recurring case of Lassa fever, it means that there are factors responsible for this. So what are those factors that, help this disease to keep recurring in Taraba State and possibly northern Nigeria?
Yeah, of recent, Taraba State has been one of the states recording Lassa fever, which was not so in the past few years. But the reason being that because of the fact that the world is a global village, a lot of travels, people are displaced, especially with the insecurity situation. People traveled a lot. And so some of them that are carriers begin to spread the diseases, more especially where there are cases of insufficient hygiene among the populace. And the other issue is that with the bush burning, some of the rats that are carriers of the disease are being displaced from the neighboring bushy areas into the urban centers because their foods and places of harbor are being destroyed by this bush burning. And so they find solace in households, especially households that have exposed food products where they can feed on and then continue to spread through their droppings and urines on exposed foodstuffs.
For someone who's probably just entering into Taraba or into northern Nigeria, this certainly is does call for lots of concern. But it would help if we understood, the signs and the symptoms of the disease.
Well, the disease is that people present with fever like any other disease. Then they have red eyes and the condition deteriorates over time. And that is the infectious period, more especially if they are food handlers or if the foodstuff available are contaminated. But I don't think people should panic. It's a question of improving personal hygiene and environmental hygiene. And of recent, the issue of refuse disposal and environmental cleanliness has been stepped out by the government that established an agency to ensure that all rubbish dumps that attract the rodents are cleared from within the metropolis. So I believe in no distant time we will see the end of this disease within Jalingo metropolis. But I believe it's not a cause for concern now, as long as one maintains scrupulous hygiene and also avoid eating exposed foods within the metropolis.
Dr. Obadiah, thank you so much for joining us on Network Africa.
Thank you.